Every morning, countless seniors reach for a slice of white bread or a bowl of sugary cereal, thinking they are simply indulging in a familiar comfort. These foods seem harmless, part of a routine they've followed for years, but beneath that innocent appearance, a silent danger begins to brew. It starts quietly, with subtle symptoms like fatigue or mild dizziness that they often dismiss as normal signs of aging. Perhaps they notice their hands feeling slightly colder than usual or experience a fleeting blur in their vision, but they brush it aside, attributing it to tiredness or just getting older. This is the beginning of a perilous chain reaction happening inside their bodies. Those simple carbohydrates cause rapid spikes in blood sugar levels, often reaching peaks of 180 milligrams per deciliter within just 15 minutes after breakfast. Such sudden surges initiate an inflammatory response within the arteries, an invisible, low-grade inflammation that damages the lining of blood vessels. This inflammation silently weakens the arterial walls, making them more fragile and prone to tiny tears. These tears are tiny breaches that many seniors overlook, dismissing the uneven sensation of numbness or mild discomfort as normal. Meanwhile, fats and cholesterol from the bloodstream seep through these micro tears, accumulating beneath the damaged lining and forming tiny deposits of plaque. Over the course of several months, these micro tears and deposits begin to develop into more stubborn, larger plaques. These plaques cling tightly to the artery walls, gradually narrowing the vessel's diameter by up to 50% in some cases. Blood flow becomes impeded, depriving vital organs of oxygen and nutrients, no matter how lightly one feels these days. Several seniors recount noticing symptoms such as cold extremities, brief disorientation, or a blurred vision that lasts only a few seconds, but they dismiss these as minor symptoms of aging. Little do they realize, inside their arteries, a dangerous process is unfolding, inching them closer to catastrophe. The local buildup of plaque transforms entire segments of arteries into regions of partial blockage. These blockages are often asymptomatic until a dangerous rupture occurs. What begins as tiny, unnoticed tears within fragile plaques can, under specific conditions, escalate into a full-blown rupture. When a plaque ruptures, it exposes its contents, triggering the sudden formation of a blood clot, an urgent, life-threatening event that can completely occlude the artery within seconds. This rapid, catastrophic process can happen at any moment, often catching seniors off guard. The clot's formation is silent, swift, and relentless, blocking blood flow entirely and setting the stage for a massive heart attack or stroke. A senior who ignored the early warning signs, a brief numbness, cold hands, may find herself suddenly unable to speak, collapse, or lose consciousness without any prior indication of alarm. These gradual, seemingly harmless dietary choices are creating a ticking time bomb within each individual. Each step in this process emphasizes how ordinary breakfast foods, despite their harmless appearance, are fueling a deadly progression. The inflammation persists, the plaques grow larger and more fragile, and the inevitable rupture becomes more imminent with every passing day. It is a perilous cycle, one that can culminate in death within moments of the clot forming, often leaving families devastated and emergency responders helpless in the face of such rapid and silent destruction. The once sturdy plaques inside the arteries are far from stable. Over time, they become fragile and increasingly prone to rupture under normal blood flow stresses. When a plaque suddenly tears away from the vessel wall, it exposes its inner core, a complex mixture of cholesterol, dead cells, and inflammatory debris, prompting the immediate formation of a blood clot. This clot begins to develop silently, like an invisible noose tightening around the torn plaque. Within seconds, it cocoons the rupture site, expanding exponentially and completely blocking the affected artery. The entire process happens so rapidly that victims may remain unaware until symptoms of an impending disaster become unavoidable. The plaque rupture and clot formation are like ticking time bombs, silently waiting for the right moment to unleash destruction. What follows is even more terrifying. The blood clot enlarges swiftly, often within 30 seconds to a minute, spreading like a dark cloud that blocks the entire artery. It effectively cuts off oxygen delivery to vital organs such as the brain or heart. In the case of the brain, this rapid occlusion causes an ischemic stroke, leading to sudden loss of speech, paralysis, or unconsciousness. When the heart is involved, the result is a massive heart attack, characterized by crushing chest pain, shortness of breath, and rapid deterioration of cardiac function. This complete blockage can lead to death within moments, especially if emergency medical help is not immediately available. The victim might experience a sudden collapse without prior warning signs, as blood flow to critical tissues is abruptly halted. The disturbing truth is that the final clot that causes the catastrophe was actually set in motion many years earlier. Doctors often discover this after autopsies or during emergency interventions. It becomes clear that the process began from seemingly harmless daily habits, such as consuming foods that fuel inflammation inside arteries, white bread, sugary cereals, processed snacks, over extended periods. These habits accelerate arterial aging, weakening vessel walls, and fostering microtears that develop into larger plaques. The tiny breaches in the artery lining are like small cracks in a dam, which gradually expand until they rupture under blood pressure of about 120/80 millimeters of mercury. Even a normal meal at 65 or 75 years of age can cause a blood pressure surge of 10 to 15 millimeters of mercury within 5 minutes, increasing the stress on already fragile plaques. Each such episode is an incremental step, undetectable at the moment, but crucial in the slow march toward rupture. The plaques, once stable, become fragile and prone to tearing, triggered repeatedly by the high blood sugar spikes and inflammation tied directly to dietary choices. It is this cumulative damage, built quietly over years, that prime the arteries for catastrophe. The final, fatal clot is merely the culmination of previous micro-injuries, silent inflammation, and plaque growth, all orchestrated by daily eating habits that many seniors continue without awareness. The moment the clot fully occludes the artery, the cascade of destruction is irreversible, a brutal testament to how small, everyday choices unknowingly shape life and death outcomes. Autopsy reports from numerous hospitals and forensic examinations have painted a chilling pattern over recent years. In almost 9 out of 10 cases involving sudden and unexpected death among seniors, the cause was an unnoticed rupture of a plaque deep inside a major artery. These ruptures did not occur from trauma or external injury, but rather from long-standing, seemingly harmless daily habits that gradually weakened the arterial walls over decades. The process was silent, insidious, and often overlooked because the victims had experienced only mild, often dismissible symptoms, such as brief dizziness, transient numbness, or fleeting chest discomfort. What makes this pattern so terrifying is that these warning signs appeared just moments before catastrophe struck, and many victims felt fine up until the final second. Their last words or gestures often echo a confusion, words slurred, a sudden inability to speak, or a rapid collapse after a brief episode of discomfort. In these fleeting moments of confusion, the true danger was already unfolding. An artery that had been compromised by a small invisible tear had grown fragile, and when it finally ruptured, the ensuing blood clot rapidly occluded the vessel, cutting off oxygen supply to vital organs like the brain or heart. The victim had no chance to realize, warn loved ones, or seek help. The damage was done in a flash, an irreversible cascade of destruction triggered by a process that had been silently building for years. The cause of this tragic pattern can be traced back to often overlooked daily dietary choices. Seniors routinely consume foods that fuel internal inflammation, white bread, processed snacks, sugary cereals that accelerate aging of their arteries. Each high-sugar meal causes blood sugar spikes that can peak as high as 180 milligrams per deciliter within 15 minutes. These spikes exacerbate low-grade, chronic inflammation that weakens and damages the lining of arteries over time. Microtears form in the arterial walls amid this insult, allowing cholesterol, fats, and inflammatory debris to seep into the vessel walls, setting the stage for plaque formation. This process is relentless. Every time these microtears occur, especially when blood pressure surges to 120 to 130 millimeters of mercury after eating or during physical activity, they deepen and expand, creating unstable plaques that are prone to rupture. The deterioration is gradual but consistent, building within the arteries like a ticking time bomb prepared to explode at any moment. What many fail to grasp is that the rupture of these fragile plaques is the finale of a decades-long process, an event that often occurs without warning in a split second when internal inflammation reaches critical levels. The final act is often a heart-stopping moment of chaos, When a plaque tears the exposed inner core, containing cholesterol, dead cells, and inflammatory substances, triggers the rapid formation of a large blood clot. This clot acts like an insidious trap, growing silently and swiftly, within 30 seconds to a minute, expanding like a dark cloud that spreads through the artery, it cocooning the rupture site, shrinking the vessel's lumen to near zero, and halting blood flow entirely. In some cases, the clot is large enough to block the entire artery, causing an ischemic stroke, if in the brain, or a massive heart attack if in the coronary arteries. The victim's body begins to shut down as oxygen is sharply cut off from essential tissues. Brain cells begin to die within seconds, leading to sudden unconsciousness, paralysis, or loss of speech. The whole process happens so rapidly that by the time emergency responders arrive, irreversible damage has often already occurred. The tragic truth is that in many of these deaths, there was a silent warning sign just seconds before, a fleeting feeling of discomfort, a trembling hand, a brief dizziness. Yet the victims, unprepared and unaware, collapsed and lost their lives before any treatment could be effective. Over years, these micro-injuries, coupled with dietary inflammation and internal pressures, set the stage for the final, catastrophic rupture, unleashing a chain of events that ends in fatal arterial collapse. The buildup of these tiny, silent tears and vulnerable plaques, driven by everyday habits, is the invisible mastermind crafting the grim fate that too many seniors meet without warning, underlining the urgent need to address internal inflammation before the destruction becomes unstoppable.